For the last 2 months or so, the coronavirus cases in the UK appears to have started to rise again. 3 or 4 months prior, once a good amount of vaccination was done in the UK, it looked like that the coronavirus wave has tapered off and the pandemic has been brought under some control. But during the past few weeks, the cases has once again spiked, and recently the coronavirus cases in the UK has recently hit a mark of over 53,000 cases per day, which can be compared to the all-time high 68,000 cases per day which was recorded during the second wave of coronavirus pandemic. Similarly, in the United States as well, we can once again see the cases to have started to rise once again after what it looked like the cases were declining in the United States during the month of February to June once a decent amount of vaccination was carried out in the United States. Recently, the per day coronavirus cases count in the United States has once again crossed 100,000 mark, which clearly indicates that there is a fresh wave of pandemic in the United States. Other than the US and UK, we can also see that the cases are also rising in the countries such as Israel, France, and Italy. One of the reasons which is being given for the current rise in the coronavirus cases is the spread of the Delta variant of the coronavirus. The Delta variant, which was first identified in India and was the primary cause of the second wave of coronavirus over there, is far more contagious than the original COVID-19 virus and therefore spreads far more rapidly. Data shows that of the COVID-19 samples sequenced currently, 98% of the samples belong to the Delta variant in the UK. This number is 93% for the United States, and for India, this number is 81%. Therefore, it can be inferred that most of the infection which is being spread in US and UK and other countries is because of the Delta variant of the coronavirus. Also, it has been found that the vaccines which are being used currently have a lower efficacy against the Delta variant. In a recent study published by New England Journal of Medicine, it was found that the efficacy of the Pfizer vaccine after 2 doses of vaccination drops to about 88% for the Delta variant, whereas for the Alpha variant, this number is close to 94%. Similarly, for the Oxford AstraZeneca vaccine, the efficacy after the 2 doses drops to 67% for the Delta variant, whereas for the Alpha variant, it is close to 74%. Therefore, the rise of the Delta variant provides some explanation to the latest increase of the cases in the US and UK. Another reason which can be provided for the latest coronavirus wave in the US and UK is the fact that despite good amount of vaccination that has been carried out over there, still a significant chunk of their population remain unvaccinated. In the UK, currently 70% of the population has received the first dose of the vaccine and close to 57% of the population has received both doses of the vaccines. In the US, the vaccination percentages are 58% for the first dose and close to 50% of the population has received both the doses of the vaccines. Moreover, it has been found that the people who are unvaccinated are far more likely to get infected, and also it has been found that they are far more likely to catch up a severe infection. Presently in the US, it is being stated that the unvaccinated people account for 99.5% of the deaths and 97% of the hospitalization because of the coronavirus. The third reason which can be attributed to the present rise in the coronavirus cases in the US and UK is the fact that the efficacy of the vaccines against the coronavirus seems to decline over time. Recently, the CEO of the Pfizer has said that their company in a study has found that the efficacy of their vaccine has dropped to about 84% 4 to 6 months after the second dose of the vaccine was given. The original efficacy of the vaccine was about 96%, which means that in every 2 months or so, the efficacy of the vaccine has dropped by about 6%. Their company has also said that they are planning to start recommending a third booster dose of the Pfizer vaccine. In a similar study, Israel, where most of the vaccination has been carried out by the Pfizer vaccine, has found that the vaccine efficacy over there has now dropped to around 64% against preventing the symptomatic infection. However, the same study also said that the vaccine is still 93% effective in preventing the hospitalization. So the reduced efficacy of the vaccines or the actual efficacy of the vaccine in the real world can again be one of the reasons which can be ascribed to the present upswing in the coronavirus cases. But does the latest rise in the coronavirus cases means that the vaccines have been ineffective in preventing the spread of the coronavirus infection? It might not be so, because the data shows that while the vaccines may have a lower efficacy in preventing the symptomatic cases of the coronavirus, they remain very effective in stopping the severe cases of the coronavirus as well as the hospitalizations, which means that although it is likely that you may still get a coronavirus infection even after receiving the coronavirus vaccines, but the chances that you'll end up getting a severe case of coronavirus or end up getting admitted to the hospital is far low if you have been vaccinated compared to if you have not got vaccinations. We can see this in the data of the coronavirus obtained from the UK as well, where you can see that during the latest wave, the number of hospitalization because of the coronavirus remained far lower compared to the last wave of the coronavirus in December, where a far greater number of the people were got admitted to the hospital. This trend of lower hospitalization compared to the number of coronavirus cases can also be observed presently in the US as well. So, if the third wave of the coronavirus arrives, then how will it impact globally? Like, what will be the magnitude of the third wave of the coronavirus? How many cases are we going to have? Well, the magnitude of the third wave of the coronavirus will actually depend on the present vaccinations which are being carried out as well as the efficacy of those vaccinations. The magnitude will also be a function of the latest mutations which have happened or might happen in the coronavirus. But if we draw inference from the trend which we are observing from the US and UK now, we can say that even if the number of coronavirus cases rise significantly, the level of hospitalization and severe cases of coronavirus is likely to remain low. Similarly, can we state how various countries will be affected by the third wave of the coronavirus? It is difficult to say how different countries will be impacted by the third wave of the coronavirus because during the first and the second wave of the coronavirus also we have seen that the different countries were affected differently by the coronavirus. Similarly, the impact of the third wave of the coronavirus is likely to be different for different countries. This will depend on the factors such as vaccination percentage, the efficacy of the vaccines which were used, how severely the coronavirus has impacted that country during the first and the second wave, the demographics of that country, the level of healthcare facilities available in that country, and how well the social distancing and lockdown protocols are implemented in that country. So, can it be estimated that when will the coronavirus pandemic And again, it can be said that the coronavirus pandemic can be brought under good amount of control with effective vaccinations. So, assuming that the present set of vaccines are effective in controlling the virus, and also assuming that the virus does not mutate any further, or even if the virus mutates, the present set of vaccines, or maybe some future sets of vaccines, are effective in bringing in end to the virus, then one can reasonably hope that with effective vaccinations, the coronavirus pandemic will eventually be brought under adequate control.